Representative Lamarco, followed by you, followed by 2 business owners, large restaurant owners, and then we're going to wrap it up with Chris, the city manager, at the end. He's a trusted regular representative here, and then we'll go to our regular agenda items. So shouldn't be too long. And I have Keith Farrell from Neighbor Support. He's wonderful. He's a tech guru and all things wonderful. So he'll be guiding us. And who do we have so far, Keith? We've got 13. Mary, do you want to start taking roll call?
Yeah, why don't I just go ahead and announce how people can do that. They're just going to go out on chat and say their name and the whatever they're with, the homeowners association that they're with, and then we'll keep an eye on it throughout the meeting.
Hey, Abby.
Hey, guys.
Half an hour ago. Very different.
It's good to see everybody.
Feel like a long time.
Hey, guys.
Hey.
Look at your beautiful wall. That's gorgeous.
Thanks.
Oh, that's nice, Barbie. I like it.
Yeah,
That's all yours, right?
yeah, my eclectic
Oh,
living.
I love that palm tree.
Thanks.
You have the same.
So we're asking everybody to chat their name and their neighborhood association in the chat box so we can make sure we get or obtain quorum.
What a good idea.
Say hello.
Two.
Say hello. Hello.
My chat is only going to Keith. Is that okay? You taking, or should it be to everyone?
You know what? It's fine.
Okay.
Yeah, you send it to Keith or Mary. Mary's actually taking roll call.
Yes, if you would, as you come on, if you would in the chat, the Zoom group chat box, just put your name and what homeowners association you're with. I kind of know everybody, but I don't know everything that I know. So if you would do that, it'd really help out. Thank you.
Well, yes, but it's only
You should have the option to send it right to Mary, and if you could send it her way, she's keeping roll call.
okay.
Hi, Dennis.
I don't see. So let's undo the chat then.
And Christina, how are you?
Close the chat and open-
Representative Lamarca, hello. Thank you for joining us tonight.
Oh, here it is. You choose-
Happy to be here. I'm going to unmute myself.
Okay, got it there now.
Vice Mayor, hi.
Hi, Colleen. How are you?
I'm great. How are you?
Excellent. Thank you. Happy birthday, Steve.
Thank you. Much appreciated.
What'd you have to eat that night?
we played it cool. What did we do?
What did we do?
I don't even remember. It was a very low-key night, I gotta say. It wasn't special. We didn't do anything special.
Okay. You didn't have everybody in the neighborhood just drop off some food?
Dancing in the streets.
Okay.
We've been severely challenged these days. We're having to buy our own food now that there's no social gatherings. It's
I
bad.
can't. I think of you every day.
I love it. Now, where's the send button? Send the chat.
So Steve, we don't have you on the agenda for tonight. We're gonna absolutely.
Don't worry.
Yeah, but you've got a lot of great. Loved your plan, and to the degree you want to pipe up tonight, you're of course welcome.
I'm here to listen. I enjoy listening and learning and just all the latest. It's all good. Don't worry. If anybody has any questions, I'm available.
Once again, for anybody that's just come online, if you would put your name and what homeowner association you're with
Do it.
in the chat box, then I can go ahead and just check you off the roll call. Thank you.
Get a little more light on this.
Mary, are you getting the chat? I'm getting a lot myself, and some people are saying they can only send it to me. So I can save the chat, and I'll forward it to you after the call too.
Yeah, you're defaulting.
I am getting them. I've got about 8 or something. I'm seeing them.
Okay.
Is that what you're seeing?
Some of them are just saying they can only send it to me.
Yeah, you're the first one on the drop down, Keith, and unless someone takes the drop down and looks, that we can't. You have to be able to look for Mary to send it to him. We did.
Well,
That's probably why. Because he probably started. He's the default drop down. Is there a group chat for everyone? And is there a group? I don't see a group chat selectable.
Tiles,
The
yeah.
entire group.
Do you want to make it bigger?
Yeah, we disabled it for this
No, we're on.
Okay.
We're not muted.
co-host.
Okay. Yeah, it's a couple of minutes. So Chip will be out too.
Come here, say hello.
Do you want the want to mute or
10
unless we
minutes.
talk? Let's mute unless we talk.
Hi, Tim. Thanks for joining us.
Hi, Colleen. Glad to be here. Thanks for putting it together.
And you got the email with the questions, right?
I did. Yes, I did.
Great. Thank you. So we'll wait a few more minutes and then get started. And Keith, you want to kick it off by explaining kind of the layout of how this is going to work tonight?
Sure thing. So I'm actually going to start by muting y'all. So the only people that will be able to speak to start will be the presenters. But if you have any questions, you can enter them into the chat, send it to one of the hosts, and we'll canvass the questions to make sure they get asked. Or you can send an email to chorusspec@gmail.com. It's correspec@gmail.com.
So why not, Keith, why don't you or Mary just type that in the chat box so people can cut and paste?
Mary, do you got that? I'll put it in a second. And then the only other thing I want to say is that if, besides using the chat, if you'd like to unmute your line and ask the question live, just be sure to use the raise hand feature, which you can get to by going to the bottom of the Zoom bar, clicking on participants, and then finding your name, and there'll be a raise hand feature. But using the chat is definitely easiest. And with that, Colleen, it's all you.
Okay, great. So we have 33 participants. Thank you all very much for joining us tonight. We are deferring our regular council agenda items to the latter half of this meeting to allow our speakers to go first. And our focus tonight is reopen plans. You all may know the city held their workshop yesterday and the county held a special meeting today to discuss reopen plans. The county commission voted in general agreement that our reopen date is Monday, May 18th for phase 1. There are several aspects of that are still unclear. There were mixed reviews on whether and to what degree we would be opening beaches, as well as whether to allow restaurants to open at 25 or 50% capacity for inside dining. No bars, no large venues as before. Our county administrator, Bertha Henry, will be coordinating with Miami-Dade. We want to be consistent with regard to beaches. Obviously, a number of comments were made about the need for consistent communication and adequate preparation. There was a lot of recognition that we do not yet have contact tracing in place to the degree that it is needed. And there were general concerns about whether people would act responsibly upon reopening, which is why Memorial Day weekend is being avoided. And if they did not act responsibly, to what degree we had adequate enforcement in place to help avoid a potential resurgence. Our reopen directive will require Governor DeSantis's approval. Now I'd like to turn to our speakers, each of them in turn to provide their insight and guidance. We're going to begin with Representative Chip LaMarca We are honored to have Chip join us tonight and offer a statewide perspective. Chip, first of all, thank you so much for all you've done to help our community, going back to Lighthouse Point City Commissioner days, to Broward County Commission, now to being our representative in Tallahassee. From the opening of Birch State Park here to all the unemployment assistance you have provided, you continue your track record of robust support for all of us. Thank you for being a valued and trusted public servant. Here are a couple questions, I think, to allow people to also get to know you a little bit. Can you tell us a little bit about your first term in Tallahassee and what some of the most important items were from that session?
Sure, Colleen. Well, thank you, and appreciate everybody allowing me to get a few minutes on here. I see a lot of familiar faces, and at some point in the future, we'll be able to do this in person. So this, when you say term, our terms are 2 years. So the first and second year, what's really relevant to what is going on with COVID-19 and the coronavirus. Last year, so in 2019, we dealt with telemedicine, which, you know, I think everyone understood was significant, but didn't know that we would be using it so quickly. And I see Dr. Ryder on here, and I know that some of the issues that we're facing, we're just now hearing folks that are quite honestly afraid to go to their doctor or go to the hospital for other normal issues that they would be having outside of the coronavirus because they're afraid of the disease or the virus. Sorry, but telemedicine is one of the things, and I know the governor also included that any healthcare provider in the state of Florida must include telemedicine, and I believe that at no additional cost. So I think one of the most important things is that we're looking at technology in healthcare. This year we did a legislation called Advanced Practice Registered Nurses, and basically it was an expansion of scope, which we thought when we were doing it, it was really the basis of it were rural areas where there were not enough doctors, MDs around, and the right nurse with the right skills could do a lot of the functions if a doctor was not available. That passed this year. One of the most important things for all of us, and if I could step away from the virus issue, COVID-19 issue, we finally fully funded affordable housing for the first time in many, many years to the tune of $370 million. That will be, I'll cover that after a couple other things, but that's going to be something we're going to revisit. And it's my understanding from what the governor has been saying over the last 72 hours is that we're really expecting not to change a lot of what was done in the budget. He hasn't signed it yet. If he doesn't sign it by the end of the month of June, it will go into effect automatically. But he does have line item veto power. So we're hoping that significant issues like that, beach funding legislation, which is coastal management, we did that last year. We also passed a hazing law that dealt with university and college students to protect young lives. And also this year, those who are paying attention to the issues about collegiate athletes and student athletes, we passed the second in the country name, image, and likeness law, which basically would state that college athletes, if and when they ever go back to college and they're eligible, will be able to benefit off who they are, their name, image, likeness, and brand, just like any other student. Some of the things that were important, as I mentioned, telehealth. We also had, continuing from the Parkland massacre, we had a law passed called Alyssa's Law, and it's for Lori Aladef's daughter, Alyssa. It was named after her. I was a co-sponsor with Representative Daley and Representative Gottlieb, and that is basically requiring panic alarms in all schools, all K-12 schools. And finally, the other issue that was significant because it was a signature issue and a legacy issue for a friend of ours who was a former county commissioner, then state representative, who just passed away just a few weeks ago, Kristen Jacobs, and that was the shark finning ban, which I co-sponsored with her for the last couple of years, but it passed off the House floor and became law, and the governor signed it, and it's actually named after Kristen. So that's kind of the last couple of sessions as far as legislation. Obviously, we've got a lot going on separate from that that's dealing with the coronavirus.
That's wonderful, Chip, and no surprise that you're well entrenched and crossing the what do they call it? Crossing the aisle. Yes. So let's talk a little bit about
in the middle of the aisle.
You're in the middle of the aisle, safe place to be. So let's talk a little bit about COVID. Can you tell us from your vantage point, we're listening to the governor's press conferences, but what are you witnessing, what he's doing behind the scenes to respond to COVID, and talk specifically about the money that's been dispersed through unemployment, if you can.
Okay. So thanks, Colleen. There's a couple things with regard to when we left Tallahassee, we extended by a few days. We came home on basically March 13th when we were supposed to end, but we didn't vote on the budget yet. So we had to let the budget cool off, as they say, and we had to come back 72 hours later. So we went back on March 19th, which was just after that St. Patrick's Day weekend. Came back on March 19th, voted on the budget. And as soon as we voted on that budget, we knew we were in the middle of something going on. We didn't know the effect or the extent, sorry. Ultimately, we put $53.5 million of the state's general fund budget aside for direct issues with COVID-19. We also put another $4 billion aside in reserve, overall reserve, $300 million specifically for COVID-19. Again, $300 million plus the 53. That's kind of what was specifically geared towards dealing with this issue. And if you've watched what the governor's been doing with a couple of our Broward folks, Shane Strom, who's his chief of staff, and also Jared Moskowitz, who is the director of emergency management. They've spent quite a bit of money, whether it's on PPE or other issues for testing, setting up the National Florida National Guard. And ultimately, I had mentioned we put $4 billion in reserves. The federal government, as of right now, is we know that we've already received $4.3 billion with a B, in addition to the $4 billion that were put aside. We believe that the governor has had communications with the administration, with the White House, and that we'll have roughly $12 billion in total between reserves and to deal with the coronavirus issues. We don't, where we are with the data on economic research on what we can at least model right now based on, and you're going to hear from some business owners and restaurateurs that can tell you better, but based on where we think we will be with tax receipts, sales tax, that type of thing, we think if we come out of this economically by the end of the year, it'll be an $8.1 billion impact to the budget, which we would have in reserves and federal dollars. If it goes to June, it would be closer to 10.1. So first quarter, second quarter of next year, we're in a point where we'd have to make some serious cuts. We'll be back up there by then, but we obviously want to gauge the budget before we get to next end of budget. So that's kind of where the dollars and cents are from a standpoint of really, I think what's important, and you covered some of it, Colleen, with respect to opening and where the governor communications been. But let me take a half step back though. There were a few things that we were able to be effective on. I don't want to take credit because it took a lot of folks to get it done, but we extended property taxes statewide for a couple of weeks. That has since passed on April 15th, but if there were folks that didn't have their taxes in by the end of March, they got a couple more weeks with regard to that. There are also extensions of corporate filing. So anything from an LLC to a small business to a large business, any type of corporate filing in the state of Florida was extended for 2 months. Additionally, corporate sales tax, which is something we're trying to get rid of in the state of Florida, but they've been extended for 2 months as well. So that's kind of where the financial side of things lies. But with regard to opening up, you had gone over what you said was about exactly as I took it from the meeting as well. But what I did hear was they're going to coordinate as well as they can with Miami-Dade and do a opening alongside them. But I also heard that if they're not ready to move ahead on certain issues, Broward may go it, I don't want to say alone because Palm Beach has already gone for it. So that is an option there. And then the number I heard back and forth, which is really important, and I know Tim and Mike can cover more of this, but the restaurant folks that are up my way are probably saying the same thing. They're going to say you can't run a takeout, you can't run a restaurant with 25% capacity. You might as well just do takeout and not fire up some of the other equipment and bring more people in and expand the menu. So the number that Broward County has been talking about is 50%. And then on the beaches, which I know Steve and I cover areas that include our beautiful beaches, I heard at least 5, if not 6, when Commissioner Bogan weighed in, that we're interested in some type of staged or phased opening for the beaches, which is important. I mean, we clearly don't want to see, spring break, but we want to make sure that if people want to go down to the beach, actually get in the water and exercise, that people can do these things and be responsible. I think the end of the day, though, it's up to leaders like you all on, whether you're elected to serve in the city commission, the county, or the state level, or to serve on your homeowner associations you have. We're all in the same boat. People are looking to us for leadership. People are looking to us for answers. And ultimately, we are going to be looking to every single person, whether it's a restaurant employee, a business employee, or someone on the beach who's just a neighbor or someone we don't know, to make sure they follow the safe distancing and things like that. Because what I'd hate to see is us get to the point where we finally have some more freedoms. We're able to go outside, exercise, and enjoy the beautiful place we live. And then folks ruin it for the majority. And we also have to think of our men and women who put a uniform on every day to protect us. We don't want them to have to deal with it as well. So we just have to be cautious about this. And ultimately, to your point, the state is working well with local governments, which is important. I think Steve could probably tell you, from the mayor of Fort Lauderdale being on one of the work groups and other members of our community being on the task force and all that. There's been, there's always a lot of good talk about politics because it's interesting and people like the back and forth. But the reality is we've all worked pretty well together on this. And, Jared Moskowitz is a perfect example of, picking somebody for their abilities, not their political party. And you did ask me, I'm not skirting the question, you did ask me about DEO. We started a hellacious mess with, I'm just going to be blunt, with what Rick Scott left us. I'm ready to go to war with whoever wants to go war with me over what he did to the state. People were trying to get their benefits they paid in for. The system's broken, and ultimately when this pandemic is over, it will be scrapped and a new system will be put in place that works. That being said, Governor DeSantis put in the secretary from Department of Management and Services, which is really real estate, real property, technology, everything that the state kind of uses as the backbone. He put him in charge of the system about 2 or 3 weeks into this process. And we've gone from, I think on April 20th, we had about 6% of the claims done. Dollar-wise, that was somewhere under $100 million. We've now passed 1.5 billion with a B, and 650 to 700,000 Floridians are starting to get their payments. The one thing I can say on top of the angst that folks have had of not getting these payments is that the governor made it retroactive to either March 9th, all the way back to March 9th, or when you were separated from employment. So it's going to take a while for some, but a lot of folks have been updating us and kind of giving us the the most current information on them getting benefits, and it's much more in the good place than were a week, 2 weeks ago. So it's getting there, but I think we have to do a little bit of digging when this is done, and I think an audit should be done, and we'll figure out what happened. But the most important thing is getting folks paid.
Chip, thank you so much. I know how hard you're working. I also appreciate the flexibility that the governor has shown compared to other governors from other states in terms of local jurisdictions having more say. But we could not be more grateful to you as a community for all the support and help that you provide our citizens. Those numbers are amazing, and I know you're going to continue to work hard. And I think the sentiment that we're all in this together, that it is all up to all of us, and as a reminder to everyone else to continue or hopefully begin to behave responsibly. We need to be safe, but we also need to get started again. So thank you so much. Keith, were there any questions that came through that we wanted to add to the list for Chip to ask him?
No questions came in on my end.
Colleen?
Okay. Yes.
Can I just say one thing? I started to chime in, but I just want everyone to know how much I do appreciate Chip's efforts on our behalf. I have found him to be so incredibly accessible by phone, by text. He's been a great conduit to the governor's office, and I really appreciate the work that he's done to help us as a city and as a county. And I just wanted to say thank you to him, because it really has been a pleasure. I mean, if you could call what these last 2 months have been a pleasure, but you know what I'm saying. It's been a pleasure the way he has been so ready to assist and always be available. So thank you.
Appreciate that, Vice Mayor. And Colin, let me just wrap up by saying, look, again, if you look at what's on your screen, we've got business owners, we've got people who run the economic development of our community. You know, we're all in this together. And as Steve said, you know, Steve and I probably have worked the most together on this during this time than we have, except maybe when we were trying to save the Historic Commission. But no, he's been great as well. And, you know, don't let him undersell his abilities either.
Thank you. Thank you, Chip. Thank you, Vice Mayor. All right. So we are now going to move on to our next presenter, Dr. JJ Rader. And I will say this about JJ. I've seen him speak on Commissioner Sorensen's call several times. I think he's also been asked to speak on national news outlets on occasion. I don't know if others agree, but my sense about JJ is he's become our own quasi Dr. Fauci. He is very knowledgeable. He's on the ground with everything that's happening, and he also has a strategic perspective. So, Dr. Rader, here are the questions for you. The greatest amount of uncertainty resides in the healthcare arena. So could you tell us a little bit about the latest updates on where we stand with regard to testing, both testing and antibody testing that's underway, the pursuit of treatments, anything that we know about vaccines that you can share? And I think the other larger question, which I wish I knew a clear answer for, and maybe you can help, is the needed collaboration and connection for healthcare systems to work collaboratively, whether it's coordinated through the Florida Department of Health or elsewhere, to get something off the ground for contact tracing. With that, I will hand it over to you, and we're very honored to have you. Thank you, JJ.
Well, those are tall shoes, big shoes to fill here. So let's take them one at a time. As far as availability of resources right now, as far as available beds, ICU beds, floor beds, at least in my system, there is an abundance of availability. The city, the county did such a phenomenal job at shutting things down in a timely manner that we were able to abort a disaster of epic proportion hitting South Florida, because in the early days, it looked horrific. And it was pretty bad for a little while, but we never reached a point where it was truly disastrous like what you saw in New York and Italy and in Washington State, for example. So right now, plenty of available resources. Now, the problem that I see, and I've been talking to Commissioner Sorensen about this now for 3 weeks, 4 weeks, the nursing homes. I think we have a small little problem that is brewing and rapidly increasing in level of concern. The reason for that is these are by and large at-risk people, elderly, multiple comorbidities, living in confined quarters, just like people on a cruise ship, being helped by people that they have no control over, just like on cruise ships. And if some of these employees were to get sick or some of these residents were to become sick, it's not going to be one person, it's going to be 20, 30 of them. And that's really what my concern is. I can tell you one of the local nursing homes got hit really hard in the last few days, and they transferred a large number of residents out of that facility. That's one facility. If this were not to transpire in 40, 50, 100 local facilities, that would have the potential of rapidly overwhelming our healthcare system. So I think that is where the next horizon lies right now, where we're really going to need to focus our attention. And, you know, I've been talking to people, but I'm just an N of one. I don't hold an official title, so who's going to listen to me besides Ben? Pretty much nobody. So that's that. As far as testing, I think you had a question about that. There are multiple tests that are on the market. All these tests went through rapid vetting from the FDA. So not all tests are created equally. We can see that certain tests have a 20+% false negative rate. What does that mean? It means you run the test, the person has every single sign and symptom of disease, the test comes back negative. But 20%, that means for every 5 people you test with that particular test, 1 of them will come back negative, and in reality they have disease. So that has been quite challenging. There are other tests that are better, and right now we're kind of trying to sort out which ones are better, which ones are not quite as good. As far as the antibody testing, there are multiple issues with that test currently. The FDA the CDC as of yesterday's update does not recommend using that as a diagnostic tool. The reason for that is quite clear. The Department of Health for Broward County reissued those same guidelines. There are some issues with these antibody testing. Why? Because there is cross-reactivity with other coronaviruses, which are just a benign cold. And some people are going to say, hey, look, I have a positive antibody test. I'm protected. Yay. They go out to do something stupid. In reality, they had a common cold, not the coronavirus. And now they have a false sense of security. Problem number 1. Problem number 2. The virus is what is referred to as an RNA virus. There are many other ones: Zika, dengue, yellow fever, influenza, HIV, for example. In many of these viruses, if you have been exposed and you have antibodies, that means you have protection, you have immunity. But guess what? In HIV, if you have antibodies, you have no protection. You're actually sick. We don't know how this specific virus is going to behave. A, so we don't know if antibodies provide you protection. B, if you do have immunity, how long lasting is that going to be? Is that going to last a month, 2 months, 5 months, a year? We don't know. We have evidence out of China, South Korea, Italy, that people that had recovered, in Israel, by the way, that people that had recovered from coronavirus and had titers, subsequently 2-3 months later, redeveloped coronavirus again, COVID-19. So that is a major concern. Was that reactivation of existing disease like you can get with herpes? Or was that a reinfection? We don't have answers for that. So there are many, many issues with the antibody testing as far as I can tell. What other questions did you have?
Dr. Ryder, Mary Pellick, when the questions come in, someone wants to know what is the status of the, I'm probably going to say this incorrectly, ivermectin.
Okay, haha. So, okay. So that was something that I think I was probably one of the first people that pioneered this treatment, and now it's actually being implemented across the world. So the data is beyond stellar. Once that data gets released, it's going to make remdesivir look like a little child that is playing on the play yard. It is that incredibly effective. Unfortunately, I'm dealing with the bureaucracy of the IRB at my facility that instead of convening an emergency meeting to bring down the barriers so the data can be released, analyzed, and published, they're like, well, you know, we're getting a meeting every other week. I'm like, you don't understand. Every other week means that another 5,000 people will die in the US alone. So that has been quite challenging. The data that I've been able to look at looks absolutely incredible. I could not believe my eyes.
Is there anything we can do to get their attention for you? I don't know, put on a show or something?
It's bureaucracy, unfortunately. And I was told in no uncertain terms, play nice with you, plays nice with them, because otherwise they can make your life living hell. So what I'm doing is what you would do with a politician. Sorry, with Mr. Lamarcon. But you call them every day, you call them 2 times a day, 3 times a day, that eventually they will actually pay attention to you because they want you off their phone. So that's what I've been doing, calling her, speaking with the IRB charge person every single day, trying to push things along.
So Dr. Rader, and I'm gonna call you out because I see your face, but you don't have to answer. Bob Swindell. Hi, I'm thrilled that you're here, first of all, but the economic development engine of our county is through the Greater Fort Lauderdale Alliance. They are connected to everyone, including the major healthcare systems locally. To the degree that it would be useful, we meaning Bob and his team, have significant leadership relationships with Baptist Health, Memorial Health, Broward Health, you name it. And I don't know to what degree that would be of any use with greasing the wheels for the IRB review. But if this is a solution that's working and you're seeing it and you're witnessing it and there's a roadblock, let's help knock that down. And Bob, I don't know if you have any thoughts.
Thanks, Colleen. I'll just add this. I mean, you know, part of our job as an economic development organization is to eliminate barriers from projects. And that's why we really develop strong relationships with our cities and county. But if we can help, more than happy to do so. We have a town hall call meeting on Thursday at 2, and we have one of NSU's top epidemiologists is going to be on the call. But you know, we realize the research and the science on this is evolving every day. And if there's local talent that we can help, we'd be more than happy to do what we can to move it forward. Thanks, Colleen.
Thank you. So, Dr. Rader, I know you're you are where you are, but to the degree we'll provide contact information. Did you address vaccines and treatment already?
Oh,
and
there were so many questions that I lost track. So
okay.
Vaccines, there are currently probably over 200 teams worldwide that are working on vaccines. The vaccines, they're looking at multiple proteins to try to build the vaccine. But even Dr. Fauci came out with some reservations about the vaccine and timeliness of the vaccine. The reason for that is the following. Some of the teams were looking at specific protein spikes on this COVID-19 virus. That spike has seen some mutations as of lately. And the concern is if there is one of those proteins, key proteins that get a mutation, the effort on that specific vaccine may be out. Also, there is currently concern about how much immunity you're going to have to that vaccine. And some of the information that came out of the NIH and some of the other regulatory agencies are that there may in the end be more than one vaccine that people get co-administered at the same time to try to have the best impact. I personally don't believe that a vaccine will be available before we have a second flare-up.
Right. Well, so in terms of next steps for us as we reopen our economy, what advice would you have for all of us other than beyond the already awareness of the things we need to do, social distancing, face masks, thermometers, other kinds of precautions? Are there any immunotherapeutic things we should be doing? Any other pieces of advice you can offer?
Just general good health. What I mean by that is it's not because you can't go to the gym that you can't exercise. You can take 2 bottles of water and use them as weights. You can do whatever other type of exercise. You can go for a walk. You can go for a jog. As long as you don't go in a crowded area, you keep your social distancing from other people, you should be fine with that. That's why I don't disagree with reopening beaches at this point in time, with the understanding that the beach is going to be to go for a walk, to go to a swim in the ocean, but not to go for a barbecue and sit there with 50 people, one on top of the other, like we saw happen in Jacksonville when they first reopened their beaches 3 weeks ago. And that's really the concern. The same thing happened in Miami Beach. When they reopened their beaches, people went crazy. And the mayor of Miami Beach had to shut it down again because people weren't social distancing. They weren't wearing their masks. And he was like, I will not endanger law enforcement by trying to enforce these types of events. And they had to shut it down again. But people need to take personal accountability. But reopening beaches is not a bad idea. Reopening parks, same idea. Go cycling, go walking, go fishing. Keep people busy, keep people healthy. That's really, I think, what a key part of this should be, to keep the right frame of mind. Because what you see what's happening on the cruise ships right now, the staff has been committing suicide. I mean, I don't know if you have seen it. There are about 4 members on these cruise ships that have committed suicide in the past 2 weeks. And that's really what is happening. Social distancing, people being cooped up in their apartments, people not being able to interact. We are a social being. We like to interact with people, and that's now being taken away from us.
Thank you very much for the hard reality. There's still so much work to do, and we are definitely dealing with a lot of uncertainty as we move forward. So appreciate you being here tonight. And Mary or Keith, any final questions for JJ?
None on my end. Nope.
No.
Okay.
And
All
the
right.
one thing I do want to reinforce, if I can just have one more minute, we need to get a few messages out. Number one, we cannot have phobia of going to a hospital. There are people now that are dying home of their heart attacks. There are people that are having full-blown strokes at home, and they are waiting so long at home that by the time they come to the hospital, it's usually too late. That phobia, we need to really get that out there, that if you have a serious health problem and you need medical attention, please come to the hospital. The COVID patients are completely separated from the general population, different wards, different staff. Extreme measures are being taken, and people do still die of common conditions, chronic conditions that they have had. So I think that's really a very large, important message we need to send out. The second message is, when you wear a mask, don't wear the mask like this. I see this all the time. People cover their mouth, not their nose. It doesn't work that way. There needs to be good message relayed by the county, by the state, about how to wear a mask, because this is going to be with us for a long time. You do not touch the front of the mask. You never touch the inside of the mask. I think that educational campaign would really need to come from the county and the state at this point in time, so people know what to do.
Wonderful.
One last question did just come in from Terry. Terry wrote that JJ spoke of a second wave, and he's just curious as to when we might expect this second wave, if it is to come.
Okay, initially, based on the data that we saw from everybody else, the concern was that it would happen with flu season, meaning October. What we're seeing now is that the virus does not behave like a seasonal virus, like the flu does. There are places where the virus is active during summer. There are places where it's active during winter. So I think as we're starting to relax the physical distancing measures and people become more cavalier with it, I think that's when we're going to start seeing a second spike. But it's not going to happen immediately. There's going to be probably about a 4-week delay before we can see the number of cases spiraling out of control, because it's not just one person getting infected. You have a 14-day delay between contracting the disease and exhibiting symptoms. Well, actually, that's not true. It's between 5 and 12 days. So, but if you take it to the extreme, it's really 12 to 14 days where people may be asymptomatic and contagious, and they keep on infecting other people. So that's where the numbers will spiral out of control at about 4 weeks after these things are relaxed.
Do we have time for one more question?
Sure.
Okay, this one's from William. Is there any information that the county health department can perform adequate contact tracing and testing?
Okay, contact tracing works well in a situation where you have few cases. For example, if you have 10 new cases or 20 new cases a day, the health department can then take resources to go interview these individuals and identify who they have had contact with for the past 2 weeks. Past 2 weeks. Oh, you went to Publix. Which Publix? When? Oh, you went to the restaurant to pick up food. Where? You took an Uber. Which one? You remember the cab, the car number. So doing contact tracing when you have hundreds, no, thousands of people in the state that are getting infected on a daily basis, doing contact tracing in such circumstances is nearly impossible. So in Australia, where the cases now are very, very few, they can actually do contact tracing, and that's what they're doing, and they're going to be successful with that. We just have too many cases to do that successfully.
So, all right. So not yet. So Dr. Rader, thank you. I think the reality is very clear. It's very stark. I don't want to say take exception to, but I think what we're trying to avoid is a resurgence that is a big resurgence. There will continue to be positive cases. We will continue to increase our testing. But so far, our health systems are not at capacity. We are going to push for people to act responsibly. Some will, some won't. We realize that. But to the degree we can avoid a complete upheaval, that is the entire point of the care and the caution being taken and the approach. No doubt there's a lot still to be defined and worked out. I think this points for me to the cautionary tale of enforcement. How do we go about managing conditions that are not being managed well? And how do we pull back from that? And where is law enforcement in that space? So I think that's an open question. And perhaps Chris can help us better understand that when we have him speak. With that, I want to thank you very much. Hope you'll come back and visit us sometime if you're willing. And we'll put you in touch with Bob and anyone else that we can think of, if that would be useful to you. So thank you,
so
sir.
much.
Yeah. Okay. So our next speakers are two very well-known business leaders in our community, Tim Petrillo and Mike Weymouth. Tim, you may know from the Restaurant People, and Mike Weymouth from the Las Olas Company. Here's what I know. I had the benefit of being on a few calls with Mike and Tim, and I don't want to say vastly reassured, but I am much more reassured about all the work that's going on behind the scenes to help businesses be prepared for reopening. I think, and I'm very grateful that both you and Tim and Mike have agreed to join us tonight, because I think it's important for our neighborhoods to hear directly from you to gain a better understanding of how hard you actually have been working to make sure not only your patrons, but your employees are going to be safe once we reopen. I heard today that Truluck's and Cheesecake Factory are closed for good, possibly Timpano's, and I'm sure there are others to be announced. Yet restaurants are being asked to open at 25% capacity. Hopefully the governor's going to approve, along with Miami-Dade, increasing that to at least 50, but how would that even work? Can you augment your capacity enough with outside dining space? So I sent you both two questions, and they have to do with sharing the preparations that you have taken so that folks know to what degree and what measures you have gone to make sure that your restaurants are going to be safe and other businesses. And then any other innovative approaches that you'd like to share that have already been implemented that are going in. And then the second question, the follow-on question is, I think helping us, we've talked about the health implications, but I think let's talk briefly about the economic implications, helping people understand your contributions to our economy and what happens and if you, and I mean the collective you, do not succeed. Help us better understand sales tax contributions and supply chain implications. So with that, I don't have you going in a specific order, so I'll call on Tim, if you don't mind going first, and we'll hear from you first and then turn it over to Mike, if that's okay. Thank you and welcome.
Sure. Thank you, Colleen, for inviting me to join this. Yeah, obviously, we are as concerned as everybody about this virus and how and when we reopen that we are giving our employees and our guests the safest possible environment to dine in and work in. We have, again, learned a lot about the virus and learned a lot about how to control this. At the Restaurant People, steps that we're taking is we're obviously all of our staff will be in masks and gloves. Our restaurants would be sanitized every night against the COVID virus. All of our tables and chairs are treated with Prevent X 24/7, which kills the virus on contact and kills that virus for up to 36 hours. And that'll be done twice a day. Single-use menus disposed of after every guest use. There will be hand sanitizing stations around the restaurant. There will be, again, we will space accordingly, 25% if that's what we're going at. And on the initial, we do lineups every twice a day for pre-service. Our employees will have their temperature tested, and there will be a health log that the manager will fill out questionnaires about symptoms and to make sure that they don't have any symptoms. If an employee has a symptom, they will be sent home immediately and then sent to go get tested, just to make sure that they are as safe as possible. Again, my concern is restaurants are built to be social. They are built to have people interact with people. Our steps of service are built to be high touch to make sure that the guest feels like they're taken care of. We have to reconstruct the entire system So if Monday we do get the go ahead, we will not open right away. We plan to open Thursday. We're calling all our staff in. They have to get what we call TRP safety sanitized served, which is we have professionals come in and talk about this and train them how to make sure they are safe and keep their sanitization standards high. And we will also have to retrain on how they're going to be taking care of our guests. We are minimizing the touches that a guest has in the restaurant to make sure that we're keeping them safe, from the greeting times to when and how they are paying for their meal. So we're reconstructing our service. Our service is built on teamwork, and from running food to bussing tables to greeting tables, we have to reconstruct that and retrain them on this new style of service. So we're going to be doing that for our first 3 days at all the restaurants. The concern I have is I can certainly manage my team and my staff. I don't have a problem with that. My concern is that I hope the guests act responsibly. Last night, I spent the entire evening on Atlantic Avenue, and that was their first night open. I just wanted to see how people were coming out, how they were interacting, and how they felt the need for masks and things like that. I will say that I had a mask on, and I was one of few people who had that. I think there's two camps that are going to come out. There is the people who, as a doctor referred to as cavalier, who, as you see them now walking up and down Las Olas, and they're kind of to-go drinking up and down the boulevard. We call it a to-go pub crawl. And they don't really feel that there's a need to social distance and whatnot. And then there's the people who are going to be conservative and take this with a high grade of responsibility. My concern is when you add alcohol to that situation, it can get out of control very fast, meaning a person may not have seen someone for a long time. They've had a drink, they go up and they want to shake hands and do whatnot. And we are trying our best to police that. We are going to put extra staff at what we call pinch points of the restaurant, where we're at the greeters stand as people come in, at the hallways for restrooms to make sure that we're not getting a traffic jam back in those areas, and in wait areas. We are going to take out as many tables as we need to make sure that there's no confusion on where people can sit and not sit. So those are type of things that we're doing. And again, we're going to have team huddles every day about what we see from our guests, what we're learning, and make those reactions, just like we go through a new opening. When we go through a new opening, we have these team huddles every shift, and we carry new processes and standard forward for the next shift. And we'll be doing that until we get this under control. Again, and we're going up and beyond the CDC guidelines because we feel that, one, it's needed, and two, the market is going to drive where people want to dine. And if people don't feel safe dining at the restaurant, regardless if we're open 25% or 100%, they're not going to come. So we feel that it is in our best light to make sure that we are raising our standards to a new height that everyone feels safe and secure, including our employees. That's the first part of the question. The second part of the question is the impact that we have. So we have 12 restaurants in the city of Fort Lauderdale. We employ 700 people. We had to furlough about almost 600 of those people in the beginning of March. That was the hardest day of my life, is to tell my team that they no longer have a job. We've been in this town since 1997. It's our headquarters. We have 45 restaurants across 5 different states, but this is our home. And I've never in a million years thought I would have to shut down my restaurants for, let's call it 60 days because of a pandemic. Last year in sales tax alone, just out of our Fort Lauderdale stores, we paid about $9 million in sales tax. So that's just in our Fort Lauderdale stores. So again, I think the impact is significant. If you look across the country, 52% of all ground floor retail is restaurants. There will be a significant fallout. There's no question. What you're going to see, and what hasn't been mentioned, you mentioned some of the, like a True Luxe and Cheesecake Factory. True Luxe, for instance, is a business that was bought by a private equity group. They did not qualify for PPP because a lot of the private equity groups have other sources of income that they can fund their restaurants with. A lot of those groups have chosen not to fund their restaurants because they're just going to, they're not qualified for the PPE. They think it's too risky to move forward. So they're going to end up closing those stores. You see that with 2J's announced. That's the same thing that happened. And the PPP program, while it wasn't perfect, it was certainly a lifeline. My concern, and my biggest concern, is once you start the engine, it takes so much capital and resources to keep it going that if we shut down, it will be a tremendous, it's a dagger to the business. So we want to make sure that when we open, we do it cautiously and effectively to continue forward, okay? Because it makes no sense to start it up and then shut it down. So again, you know, it's unfortunate. There's a lot of, we have larger patios, so we'll be able to, fortunately, not by, just by design, our restaurants typically come with larger patios. The smaller restaurants that don't have the ability to seat outside, hopefully we'll be able to do it on the sidewalks and the parking lanes or whatnot. But I question come June, July, how comfortable it might be for people to sit outside, one, on an uncovered street. So that is a concern as well. I mean, I hope I answered most of your questions.
No, that's wonderful. And it's really, really frank sharing. Appreciate that. I agree with you. The outside dining come summer is going to be tough. Outside air conditioners, they make them for yachts. That might be something worth thinking about as an innovation. So, Michael, do you want to go next and tell us about what's going on Las Olas and your plans and innovations? Keith, can you unmute Michael Weymouth?
Yeah,
there.
Okay.
Can you hear me now?
There he goes.
Okay. Hang on a second. Unfortunately, I'm having some technical difficulties, so I'm having to use my phone as well. Are you getting feedback by phone?
Michael, we can hear you loud and clear.
Okay. So this group is very lucky to have Tim Petrillo as a resource because Tim has been obviously very involved in this, and everything that he has cited, we are embracing as well. And I don't think there's anything that's been left out. We have the luxury of having a couple of restaurants that we run, and then another 13 or so that are tenants of ours, and so we've got a wide swath of different kind of people that are answering to us. Plus, what we're seeing over and above a little bit of what Tim's doing, what we're doing is we are procuring some clear shields that we can put as additional security between dividers for people that aren't comfortable. We are kind of saying where we're getting disposable menus. We're going with ours where people can, when they enter the restaurant, after scan for temperature and so on, can download our menus onto their phone and able to use their phone. There is a no contact kind of service. Also, what restaurant we are able to utilize some of the lanes for additional outdoor seating. The critical part of that is whether it's 25 or 50%, there is no business on Las Olas that is designed to be profitable at 25 or 50%. So we need to maximize the opportunity for tenants And the way to do that is because the guidelines for outside are different than inside, we have to try to provide them with an abundance of area to have the proper social distancing between tables, but expand their number of covers, so their number of tables. Fortunately for us on our Riverside restaurant, we've got an enormous amount of outdoor seating, so it's more of just creating the social spacing. As far as getting, again, I think Tim hit on every point that people need to know. These restaurants are completely dependent on that, and if they don't feel safe, they won't come back. So we are in lockstep with what the restaurant people are doing, which is making sure that people know that we have taken every precaution for their safety. Spilling over into the hotel side of things, right now we are just open to essential people. Once we are able to go back and start opening, and we've already got a lot of people that are starting to inquire, actually starting to book, so that's a welcome relief for us. The travel industry, the tourism industry is going to suffer for a very long time. We are going to become very dependent on locals for our sustainability. And so, you know, when you look how long these airlines are talking about to re-ramp and people start comfortable traveling, our hotel is going to come back much slower. Needless to say, we are testing all of our hotel employees the same as our restaurant employees, with that they're outfitted with the proper PPEs, temperature taking. We are sanitizing all hotel rooms every time somebody checks out with electrostatic sterilization and very much like a hospital. So every hourly basis, there's a whole checklist that all of our people are doing. Same with the restaurant, we do with the hotel, that there is, when we bring these back, a lot like Tim, we had to lay off, and it was the most difficult day for me. We had to lay off almost 70% of our staff in one day. And I'm telling you, if you've got people that have worked for you for years and you start doing that kind of thing, it takes its toll. So you do everything you can to get them back in a safe way, but as quick as possible. So we are fortunate that we've got excellent leadership up and down the organization, which I depend on immensely, and I'm happy to have it. Real quick, out to the Boulevard, we've got a tremendous amount of tenants who are desperate to reopen. A lot of little shop owners, whether it's Zola Keller and her dress shop, or it's Tommy Bahama. Everybody's going to open at their own pace at what they feel comfortable. I'm being told by Tommy Bahama that they're going to open up right around Memorial Day, whether it's right before, we're not going to open. Same with Cheesecake Factory. Colleen, I'm sorry to tell you, but what you're doing, Colleen, I think Cheesecake Factory is still doing takeout orders. We have been in constant conversation with them, and they are excited about reopening. Fortunately, their store on Solis is one of the best Cheesecake Factory stores in their line. They have to have of regular diners in order for it to make sense. So where you get those small mom and pop that'll do anything to get their doors open, you've got the other ones that say, okay, we need to take this in a slower pace, but open, and like Tim said, open only once. The retailers, the soft goods, the art galleries, all of them, they follow the restaurants. The restaurants bring the feet to the boulevard. There's no doubt about it. And the feet to the boulevard, as everyone knows, we operate some pretty tight confines there. One of the things we have to consider is that during the reopening phases of 1 and 2, to possibly create more social distancing foot area by converting what is the on-street parking to a temporary wider sidewalk so that people can pass each other comfortably. If you spend any time on Las Olas, you see it literally every time you go down there, whether it's a jogger who jogs out into a travel lane, what have you. But so between that, during the first two phases, and trying to provide some expanded seating area during off-peak hours would be tremendously beneficial for all of the tenants. So I hope I did a good job of backing up Tim, and I'm open for any questions if there are any.
Now, Michael, thank you so much. And thank you for the clarification about Cheesecake Factory. That's great news. Ultimately, this is a lot, but confidence, consumer confidence is a big piece of the equation. And that's why I think it's important to have us all collectively interacting and talking, because we don't do that enough. And I think it's now more than ever important. In fact, we're going to be issuing a poll at the end of the speakers, and it's basically a confidence poll. Will you go back to a restaurant? Will you go back to a gym? So I'm curious to hear folks' response from this conversation. I'm interested, Michael, in hearing what you mean by very long time for tourism and hospitality. If you could put some kind of time frame on that. And Tim, there are specific location questions for you. The reopening for Boatyard on 17th and for Tarpon River Brewing on 6th. Is there accommodation for social distancing possible there? You may have already addressed that. And I think the idea for temporary open streets, that concept being extended to many other streets besides Las Olas, would be a wonderful opportunity to explore, whether that's through the city or elsewhere. I don't even know how that would happen. But, could we get temporary open streets at some of your other locations? And how do we achieve social distancing at Boatyard and Tarpon River?
So when we took over Bimini Boatyard, just to put this in perspective, fortunately the restaurant is significantly sized. It's about 15,000 square feet. So when we took over Bimini Boatyard and relaunched it as Boatyard, it initially had 510 seats, and we relaunched it with 340. Okay, so we already, from a capacity standpoint, we already cut it down. Not because a kitchen cannot handle 510 seats at one time. That's what the driver of that was. So I don't think there's going to be an issue with distancing at all at Boatyard. And at 25%, the challenge is, like you had mentioned before, restaurants or any business is not built to do 25% of what you hope to do in sales. No one performs as a business to say, okay, I just want 25%. So unfortunately that will be a factor. And the longer that we stay at that level, the more fallout is going to happen, because the capital required to do that. And I was always a proponent of saying, okay, let's make sure the data tells us that we are on a recovery path before we even go to 25%, to make sure our 25% window is as short as it possibly can be. So hopefully when we do launch this, that we are able to get the data that allows us to open to 50 to 75%. So that's the first question. And in Tarpon River Brewery, we will be able to, now again, the bar is going to be something different, but there, in the back of the brewery itself, there's a lot of space that we use for our inventory of hops and things like that we can now spread out. We will rearrange that facility to make sure that we can social distance properly. And that's what we're working on now.
Wonderful, thank you. And Michael, what does very long time mean?
So the reality of it is that, our hotel, we run obviously seasonally, and having this happen in March, which is when we usually fill our coffee cans in the backyard with cash that make it over the summer, that did not happen. Like Tim's company, been around a long time, we're financially stable enough to survive. That doesn't mitigate the fact that there are a lot of hotels that probably won't. I will tell you that I'm glad that I am where I am, and instead of somebody else's shoes. The Hyatt Centric down the street from us at 200 ELO was, or 100, was supposed to open on April 17th. Imagine where they're at, because I'm sure that they ramping up, hiring people both in hospitality and in the restaurants, and just to find out that they had to lay off people before they ever opened their doors. So long time is dependent on a lot of things. First and foremost, hopefully the first thing is going to come back, and it's not come back 100%, is hopefully people start getting a little more confidence in air travel. That's going to take a long time. If we don't have a reoccurrence or a relapse, there are not a lot of people that are really going to be comfortable getting on cruise lines. Fortunately, the Riverhead Hotel is not dependent on the cruise industry. We get some business from them, but it's usually spillover. But additionally to that is we do a lot of group business out of our hotel. And now, you know, when you're not allowed to have buffets, when you're not allowed to have large groups, or even when you are allowed to have large groups, there are a lot of people that are nervous about it. The ripples just continue on and on and on. So I can tell you that in February, when the Super Bowl was in town, we were printing money, and to have the machine shut off like that. And I'll remind people, we're very fortunate that we anticipated our convention center down. So everybody started throttling back on the amount of work as it relates to the hospitality industry. Imagine had we not planned on shutting down the convention center and all of a sudden have the rug pulled out from under you. It would have been devastating. So our projections right now is we're looking at hopefully having probably for the balance of this year on average 50, maybe 60% occupancy, but probably closer to 50 between now and the end of the year. And you know, I even project what our average daily rate is going to be. I mean, right now we're at a giveaway rate. If people are looking for staycations, we're hoping to jump on it. But you know, it's like an airplane when it's not, when it takes off and every seat's not full, there's revenue that you'll never claw back. Every day that we don't have a full hotel, or a hotel that we were projecting to be at 75, 80, 85%, it has a tremendous impact on our budget. So I would tell you that if everything falls into place in a very good fashion, a long time is probably a little bit of a rebound a year from now. And hopefully if it moves between now and the end of next season, things will hopefully start to return to some level of the normalcy.
Okay.
And that's a completely different prognostication than what it is for the Boulevard. Thankfully, you know, with the mass that has come to the downtown area and all the people that are walking and enjoying the Boulevard, it's not the same gloom and doom picture for that. I think the Boulevard comes back relatively quickly, and that being hopefully by the boat show.
And again, I'm just to piggyback on what Mike is saying, you know, typically people in the restaurant business, the hotel business, the coffers are full on March, April, May. Those are the busiest months of the year, February, March, April, May. And unfortunately, the hardest months of the year are August, September. And, you know, knock on wood, let's hope that our hurricane season doesn't, you know, impact us this year, but that would be devastating.
Agreed.
Okay. All right. That is tough, tough, tough news. Thank you both very much for all you're doing. I know I want to support our local business community in any way that I can, to the degree that folks can help you. Staycations, going out to eat, eating out. What percentage of your revenue is potentially achievable with just takeout and curbside delivery? Does it make a dent? Is it 10%? Is it 20%? What is possible?
The only reason that we are doing takeout is to give people jobs. We lose money every day at takeout. We don't even do 5% of our typical revenue.
Wow. Okay. All right.
So we still have the with some essential people. And so because of them and because we don't want to lose some of our key management, we kept all of our management in place. Our management will now serve you. They'll bust your table. They'll do whatever they can in appreciation for keeping a job. So we're a lot like the restaurant people again, where the only reason we're open is to keep a lot of the really good people that we have busy. We know that there is an end to this whole thing. Hopefully next week is that end. We've already started to schedule to bring people back. So there is zero profit in takeout and curbside. There's zero profit in 50% occupancy. You need to get up to at least 75 to break even. So, but we're doing it to keep our name out there and to keep our people employed.
Well, thank you both very much. Really, really appreciate you being here tonight. Hopefully we'll have you come back in the near future and we can have better news and better economic indicators to talk from. So thank you both very, very much. Really appreciate everything you've done for our community, and we're excited to get back going as a community and supporting our restaurants and all of the other local businesses and hotels. So thank you both.
Thank you.
All right, so our final speaker.
I was going to turn that around. We want to welcome you back to the Boulevard. So next Monday, start coming and visiting all of Tim's restaurants, our restaurants. There's a lot of people that are going to greet you with virtual open arms.
Thank you, Michael. Face masks, I hope you're selling them too. All right, guys.
Well, just to understand the community, and I saw that April's on the call and April's on the board of the Las Olas Association with me, and we understand that there are big boys on the Boulevard and there's mom and pops, and so right now we're circling the wagons to be able to provide the PPEs, gloves, the sanitizers, and all that to the smaller shopkeepers that don't really have the access to these things that some of the larger people do. So everybody's going to be very well protected, and everybody understands so it truly, we are going to be dependent on our Fort Lauderdale neighbors.
Right, and I was actually not referring to you needing PPE. I'm thinking about the general public, and all of them being adequately covered as they arrive. So yes, we will be out to support. Okay, thank you guys so much.
Thank you.
Our last speaker is Chris Lagerblum, the city manager, and I think we all know and love Chris. And I think just a couple pointed thanks to Chris. Fort Lauderdale was the first to make the decision to close down before the county. And I think a lot of prudent thought went into moving quickly. A lot of that had to do with Chris and, of course, our elected officials. For folks that don't know about this, the city has launched a wonderful series of community resources on a couple pages on the city website. If you've not seen it, please check it out. Also, the city has been very, very active in supporting local food drives. Seen them all over the place, helping with traffic control and other kinds of support. And I think last but certainly not least is the above and beyond support for our most vulnerable, particularly the homeless, and providing the hotel rooms and support that you have. So Chris, thank you, and cool shirt. And I sent you the list of questions by email. I can read them off, or you can just address them. Which would you prefer?
So if you don't mind reading them off, that would be great. I've been on back-to-back Zoom calls all day and can talk a little bit about where we're going, I think, next week as a product of those calls. But if you've got questions, let me get to those first, and then we'll talk a little bit about the future going forward. So.
Okay, so summarizing them, enforcement is the big question. What is the plan? As it will diminish the likelihood of resurgence, do we have it ready, set up? Does law enforcement have the authority it needs? Can they issue citations, that kind of thing? That's the first question. Second question, I think you're going to mention this already, but regional consistency, Broward, Miami-Dade, and lining that up, and that's maybe also the county. Open street locations, we briefly talked about that, but the viability of considering other open street availability and accommodations for other stretches where there are large concentrations of businesses. On one of our last calls, you had mentioned internet for some of our disadvantaged neighborhoods and something called a cow. Would that be possible? I know that some of our neighborhoods would really benefit from that. And, where do we stand on the homeless and how many hotel rooms? And lastly, what can we do to help the city? I know you're repurposing staff, but to the degree that you can utilize any additional volunteers, I know a lot of us would be interested. With that, over to you.
Great. Yeah, thank you for those questions. I'll do my best to give you some answers. Before I do that, let me recognize, and I'm sure you already have, that Vice Mayor Glassman has joined on this call, and it's always important when you have elected officials that join to recognize and thank them for their leadership through these times that we're going through. So thank you to him for that.
And we did recognize him, Chris. We introduced him at the beginning, and he spoke a bit, and we're having him present at our June meeting.
Awesome. Good
So
deal.
Chris, can I borrow that shirt for the June meeting?
Yes, it would definitely fit you. You might need a smaller size.
Okay, thank you.
Okay. So let's talk a little bit about enforcement. That's a great question because there's always balance there. And, we've been in this interesting time where we've said, we want to take away from you all the thing that you all want to do during this time of the year, and that's hang out on the beach. And, there's always this balance between, can the police enforce? Yeah, absolutely. Can the police write tickets? Yeah, they can. The last thing I wanted through this whole thing was to have a clash between our law enforcement agency and the public. And so we've tried to stay on an education campaign. Some have seen that at times and said, well, the police are just choosing not to act. They've been balanced in their reaction. If you think about what our options are, it really kind of lends itself towards that balance because, we tell somebody you got to do this because the law says so, and they say no. And we say, okay, fine, let's write you a ticket. And they come back the next day. Before I move on, they write you a ticket to a court system that's not open right now. And they come back the next day and do it again. And we say, you can't be there. And they say no. And we say, okay, let's write you another ticket to a court system that's not there. And so we end up in this circle where it's a lot easier to win influence with education and support rather than win the influence through enforcement and tickets. So there's been that strike of a balance that's been difficult to figure out where's the right place to be. We get it. We get that people are tired of being told to stay at home. We get that people are tired of being told you got to keep moving at the beach and can't hang out with your friends. We get that, and we've tried to balance that as we've performed our enforcement activities. We do have sufficient staff to be able to enforce. I am cautioned a little bit that some of the discussions happen about let the beach open for certain days and not other days. Every day we attempt to take it back, and I use those words, take it back, because that's what we have to do. People don't very rarely leave it voluntarily. There runs a risk of there being that interaction, that conflict, and tensions are already high and tempers are already high. And so we're trying our best not to have that occur. But yes, enforcement is certainly possible. With respect to regionalization, I might have to have you help me with these questions again. I'm trying to grab, I didn't write them down. But with respect to regionalization, yes, that's something we've all been striving for. Whether we can get to the finish line with it or not, I'm not sure. If you've watched the news the past couple of days, you've seen that there's been some different movement in Palm Beach County than has existed in Broward County and Dade County. Governor DeSantis went out and said that Palm Beach County could move into their modified phase 1 yesterday. Broward and Dade were not given that same latitude. So to the extent that we all stay on the same path as 3 counties, that went out the window yesterday. We're still trying our best to stay in concert with Dade County to the extent we can, recognizing that we don't want to be Dade County and that our issues are Broward issues, our issues are Fort Lauderdale issues. They may make some great decisions and they may make some decisions that we don't agree with. And so I can tell you that the 28 of the 31 mayors came together yesterday in Broward County and had a long telephone call, almost 2.5 hours, as to how we could agree on consensus positions to move into our modified phase 1. I can tell you that Mayor Trentalis was on the phone this morning with Governor DeSantis talking through where Fort Lauderdale thinks it wants to be with a modified phase 1. And we were selected as one of 2 cities by the county yesterday to be the reviewers of the next executive order that would come out from Broward County, hopefully as quickly as tomorrow. We in Sunrise now have that executive order. I'm like dying to read it. It's in my inbox. And it came in just about an hour and a half ago. So that's where we'll go tonight, is to see what that says and how we might make suggestions for modifications to it. But to the extent that we can stay together as a group, yeah, it makes all the sense in the world. I really do think it makes sense, and this is where I am pretty passionate, that we all figure out how to open up our beaches together, because that is the one place that we could push our problems onto somebody else and vice versa. You know, we have this nice sandy stretch of beach, so does Hollywood, so does Dania has a little portion. And, you know, the mood from the south part of the county to the north part of the county, when you talk to the mayor of Hallandale Beach, you'll hear that their beach is their backyard because they don't have the beach that we have. They have condos that back up onto sand, and people want to be on that sand. And then you work your way north, and Hollywood's beach with the broad walk, and our beach with the adjacency of the sidewalk next to A1A, more public beaches. Moving then north into Lauderdale by the Sea and Hillsborough Beach and Pompano, working up to Deerfield. All the beaches are very different, but they all consistently have one common theme, and that's their sand and places to recreate and have fun. And so if one of us decides to allow that before the others, we have this risk of just pushing our problems onto others, and others push their problems onto us. I'm also mindful of the fact that we have a very well historically attended holiday within the next couple of weeks in Memorial Day. And that is one weekend where I think we need to be in tight lockstep with those in Dade and Dade County, as well as the city of Miami Beach specifically, because if Miami Beach does not open their beach, then we could potentially become, if we were open, the source of a festival that has not historically been one that has been met with you know, joyous activity, and in fact has been awfully crime ridden in recent years. And I don't want to bring that to our city. So we'll see how that progresses. Right now it's in the authority of the county to make the determination when the beaches will open. I've heard some thought to say, let's open them as quickly as Monday. I'm not sure that we're there yet, that we'll have to see what the next 24 hours bring. But on other things, I think you're going to start to see some reopening soon. What was the next question, Colleen?
Yeah, the regional consistency had to do with the beaches, for sure.
Okay, good.
Yeah, remaining questions were open street locations, internet, cow, and support for the homeless in terms of capacity.
Yeah, so let me do those in maybe just a bit of a different order. Let's talk about that cow thing first. We actually think we found something better, and something where we can put some industry back to work that's not working currently. We found a company, it's called Kajeet, K-A-J-E-E-T. What they're known for is establishing Wi-Fi on school buses. And while our school buses aren't operating, they're very, very reasonable. And not only do they provide Wi-Fi on the bus itself, but to a geographic area surrounding the bus. And so we're working with them. It's less than $900 a year per bus to put Wi-Fi into a community. And what better way to remind these kids to get their schoolwork done than to have some buses positioned around town that can deliver Wi-Fi in some of the underserved communities. So we're just days away from being able to finish that agreement and move forward with bringing some Wi-Fi into the areas that we talked about. So I think that's a positive step forward. And so let's talk a little bit. I took them out of order, and now I forgot what the second one was.
Open streets and the homeless.
Yes, open streets and homeless. I won't forget homeless. So open streets, yeah. Vice Mayor Glassman had a great idea early on to try an idea out at the beach by closing a lane and saying, would people spread out? And you know, we said, let's try it and see what happens, and we did, and it's been one of the most welcome things out on A1A. I'll get to the open streets with restaurants and all here in just a second, but it's worked tremendously well. The only reason you haven't seen it stay during Monday through Friday and all week is because the state wanted a much more significant barrier type system between people and cars if we were to leave it up full time. And that's why you see it broken down during the week when things are a little slower and it comes back on the weekend. We've talked about, and I know this is hotly debated, and at some point will turn quite political, I'm sure, as to what's the right thing to do with some closures on Las Olas Boulevard or parking lots behind businesses, what's the right thing to do in the Galt Ocean Mile, and how we get extra area for people to be spread out. The one thing I want to make sure we do as a staff is that we're planned for all the different possibilities. We've designed maintenance of traffic plans for all of those different closures. It'll ultimately become a matter of policy of the city to say, we want to take this lane out of commission and cause it to be an extension of the sidewalk. I've seen ideas that are awfully creative with pop-up areas for people to spend distance away from each other. So I think there are opportunities to leverage a slower reopening and a distancing of people. I don't know that it necessarily comes in the form of lane closures. It might, but I think there are other places too that could benefit from that. And we not just focus, yes, Las Olas Boulevard, very important street to our community, but there's also some side streets down off of 17th Street. There's some places in the Northwest off of Sistrunk Boulevard and even in the Galt Mile. Now, that's not to say that we're ready to deploy in all those places, but I think we need to look at those opportunities citywide and make sure we don't leave anybody out. With respect to the homeless, we recognize that at any given point, the point in time count in Broward County is about 2,500 people, and we recognize that we're not going to be able to find shelter for 2,500. But we wanted to make a difference. We thought that anybody we could get into a sheltered condition during this pandemic was one extra person served, and a person that we might connect with on the back end and move into some sort of rapid rehousing. So the difficult thing was to find hotels that were willing to work with us. Hal, I see he's on the call. He did a great job negotiating with a couple of hotels, and what they did is provide us entire floors. There's a good bit of federal assistance out there for this type of activity in the form of community development block grant money. And there's even some dollars that are now specifically targeted towards sheltering of at-risk individuals. And we will make application to be reimbursed from that grant as well. So we did some calculations and said this is what we think we can put into this program without having to put the general fund in it. And we're able to house homeless that we're starting to really form encampments in Fort Lauderdale. And that's the hardest thing to break up when we're done. Is once an encampment takes hold, it's very difficult to break up. So we distributed vouchers to those that we knew had some need. We were able to clear out the encampment behind the Salvation Army on 1st Street. We distributed almost 54 vouchers at Stranahan Park and hit Holiday Park as well as the area that was starting to form up behind the old Orchard Hardware store on US 1 up towards District 1. So in all, I think we have 109 people that we've provided shelter to. I think it's actually more than that because we have one married couple with 2 infant children that we've brought off the street, and today brought a dad and his 7-year-old daughter off the street. So a lot of good work going into that program. Yes, it will have to come to an end at some point. It can't survive indefinitely, but that's what we work on now is the reentry plan, and hopefully are successful in bringing some of these people into rapid rehousing and wraparound services, especially the parents who have kids that are living on our streets.
That's excellent, Chris, and so important. I don't know why I'm reverberating.
It was probably me. I went to mute.
No, but the fact that you're helping the vulnerable, but they're also perhaps potential carriers and that congregation, it's a public safety issue as well. So, and creative and innovative. And Hal, thank you very much. I didn't appreciate that you were on the call as well. There are other general questions for you. I think we're going to defer those tonight because of the time and wait until June. But, police bond, other kinds of things. But as far as reopen, that was the list of questions for you. We're gonna have a lot of questions in the coming weeks. We will, funnel those to you or to the non-emergency 911 call. But we'll work together moving forward. And we really, really appreciate all of your hard work, the Vice Mayor, Keith, Hal, all of the city staff, and all of our elected officials and community leaders. So, thank you very much for being
You're
here.
very welcome. Can I part with two thoughts real quick? And
Yes.
that won't take long. So talking about the police bond that's moving forward, the architectural services contract is negotiated, ready for award. And you'll see an advertisement for construction manager to hit the street tomorrow or first thing on Thursday morning. So we're moving great progress with the police bond. Parks bonds starting to move forward as well, and we just awarded the contract to AECom to manage that bond. So the bond work is beginning. If I were you all, I would be asking, and I don't want to put questions in your mouth, but I would be asking the question of how is the city's finances and can we survive? Certainly a question that I ask my team every day and spend a lot of time studying. We delivered this week to the commission, and we certainly will discuss it at next week's meeting. Our forecast for where we believe that we are financially, where we believe we are in our different funds, those revenues that we think are slower than may otherwise be, and our plan for how we cover that gap. So the commission's aware at this point as to how I believe we get through the balance of our fiscal year and how we maintain strong finances going into fiscal year 21. That's not to say we're going to build a budget that's the same as a normal budget. But if I were you all, I'd say, are we healthy financially? Are we sound? And you can always be healthier, but I would say that compared to many, we are in a very sound place. So we'll leave it and just know that we're managing this conservatively and on your behalf as well as we can.
No, thank you very, very much. And economics, that's a big question mark. A lot of folks are issuing their projections, and we've seen the county, we've seen the school district, we've seen the state. So yeah, I know we're looking at downturns and reserves and ways to manage. So and looking forward to educational campaigns. I know that the city isn't necessarily in charge of that. The county is going to be doing a lot of that, but just a reminder for everyone: face mask. That campaign is. That information, that communication is so important. So to the degree PSAs and all that are going out, I didn't have that as a question for you because I'm assuming the county is kind of running that for us on our behalf. But, we do rely on your guys' communication on a regular basis. I'll be quiet and let you talk.
Yeah, no, PSAs definitely talked about today as to how we get this message out. That was why it was nice being a part of this working group with the county and the city of Sunrise and Fort Lauderdale. It's one of those times when you're singled out that you're sort of happy to be singled out. So yeah. Yes, we will be a part of that creation of the PSA. To get word out for Monday, it's Tuesday night at 8 o'clock. And so this has to be communication that happens tomorrow. So I really think the next 24 hours will be pivotal for us knowing what next week looks like and how this reopening process starts. If I can mention one last thing, because this is terribly important. Especially to HOA leaders throughout Fort Lauderdale, is we need help getting out the word about getting counted. In a pandemic, we've had a lot of people think that they don't have to fill out the census or bother me later. We'll get counted at some point. And right now I'm focused on getting back open and I'm not focused on being counted. And we had a phone call last week from the Secretary of Commerce who said that Fort Lauderdale's numbers were lagging with respect to the numbers in the rest of the state. And people don't realize that being counted matters because it matters to the long-term financial benefit that the city will benefit from because of the numbers that it has in the census. So if we can do a full court press on be counted in our neighborhoods and get that word out, you'll start to see our messaging change a little bit. And you might wonder, why are they now talking about census in the middle of a pandemic? It's because Fort Lauderdale needs to be full court press and bring that home. So
we actually don't have it on the agenda, but we were going to do a big reminder because the mayor had indicated we were at less than 50% completion. And I think Christina shared some material that we will be pushing out. It's as close to an imperative for our well-being as a piece of our well-being for the future. And it's an easy lift, 5 minutes, right? So we will definitely do that.
Colleen?
Yes, sir.
I just want to make sure that everybody understands the amazing job that Chris has been doing. Just think about it. This man came in a little over a year ago. he's had nothing but water breaks, sewer breaks, the pandemic. I mean, you talk about like a first year in a new job. I mean, give it a break, but he hardly sleeps. He, again, just like I said earlier with State Representative Chip LaMarca, Chris is so accessible. I don't even know how he juggles everything all day with all of the people and all. To me, it's mind-boggling. So people need to know and appreciate really a great job, and the entire staff. I know Hal's on this call as well, and everybody else. I mean, our city staff has really stepped up, and I just think it's a great group of people. I just wanted to say that.
Wonderful, Vice Mayor. Thank you for that affirmation and reiteration of our fondness, admiration, and gratitude for a wonderful city manager. Thank you, thank you, thank you. Thank you all. So we have concluded our speakers. We're now going to issue a poll. It's a 5 or 6 question poll about how you all feel about restaurants and some other things in terms of reopening, your top concerns. Before we do that, I will defer to Bob Swindell to talk briefly about a marketing campaign the Alliance is working on. And I don't know if it's fair to call it a marketing campaign per se, but I love Local 2020. Keith, if you could just make sure Bob is unmuted and allow him to talk for the next few minutes, and then we'll issue the poll.
Thank you, Colleen, and it wasn't expected, and Keith, thanks for unmuting me, but great speakers tonight. I learned some additional stuff, and I was talking with Mayor Ryan and Sunrise with their draft executive order, and they've done a great job collaborating with the city of Fort Lauderdale. We've got some awesome city managers in this county. Colleen mentioned it. I'd ask you to check out ilovelocal2020.com. There's a placeholder we've already established. We own that website. We've designed a 90-day campaign to be a little local economic stimulus shot in the arm. Really promote people to eat local, stay local, buy local, everything you want to do local. We want to add an arts and cultural component to it and help some of our galleries that have also been feeling the crush of this economic devastation that we've all experienced. But get them involved as a part of this as well. It's a joint effort of all of our chambers of commerce throughout Broward County, the Convention and Visitors Bureau. So the Lauderdale's program that the Visit Lauderdale does will be a part of this. Very much like Tim Petrillo just launched his Phoenix card to get folks back to the restaurant people restaurants. We want to really encourage locals to support their local restaurants. And it's really based on 4 fundamentals, and Colleen touched on them earlier. It's, we call it the 4 C's. We've got to be consistent across the county. And as Chris said, I hope that all 3 counties are going to be consistent, but I'm glad to see that the county and the cities are working well together. We all have different concerns, and we don't all agree immediately, but they come to consensus. Confidence, we got to restore confidence in the buyer. We are 70% of our economy as consumers. We've got to get people out comfortable going out to restaurants and shopping again. And we'll have an extensive media, social media component to this. So we want our Vice Mayor, Mr. Glassman, taking a picture out, having dinner at one of the great restaurants on the boulevard, and just reinforcing everybody. It's safe, use the precautions. The other part is collaboration. That's sort of in our DNA. I will tell you, Tim Petrillo has been awesome at sharing all the intellectual property they've developed for their restaurants. And he's allowed me to share that across the county with other cities. The city of Sunrise used it extensively in developing what their requirements are going to be in their guidelines. But Tim and his team put a lot of thought into it, and they've really done a great job. If you sit down at one of their restaurants, you're going to read what their policies and their guidelines are, and I think you'll feel very comfortable dining at their restaurants, and we want to see that across the county. And the last part is compliance. The biggest problem is we don't have law enforcement, we don't have code enforcement that can, go in and determine if a restaurant's at 30% capacity when they're supposed to be at 25, or if they're at 60 when they're supposed to be at 50. So we need people to take this seriously, to have a little consideration for their fellow residents. It's not that big a deal to wear a face mask. I'm a little concerned when I heard what Tim said about Atlantic Boulevard. I've had folks that were just over on the West Coast in Naples and Marco Island, and they said you'd never think that there was a virus going on right now. So we've got to do better than that, because the last thing we want is a spike that would be the death blow for a lot of our small businesses. If they reopen and retool, as Tim was talking about, and they've got to shut down again because there's bad operators who aren't being serious about it, that would devastate us. So keep an eye on I Love Local 2020. There's going to be gift cards, all kinds of scavenger hunts, cool things to do. It's going to be 90 days. It's not meant to be long, but Colleen, thank you very much for the opportunity to talk about it, and we'll make sure that y'all get the information and share it with your different civic associations.
No, that's wonderful, and it's a perfect segue into our poll. And I'm sure Vice Mayor is going to ask you about some sort of discounts and coupons for restaurants, right?
No, but Bob, I'll be happy to do that whenever you need. You must have seen my award-winning census video that I posted on Facebook the other day. Is that why you're asking me to do this?
Okay, thank you very much. Now we're going to issue the poll. So everyone is going to be asked to answer these questions. I'm going to launch it. Can everyone see the poll?
Yes.
Okay, so Keith, I'm not sure if I need to scroll down or whether people can scroll down from the questions. Question 1 is about going back to a restaurant. Confidence level. Not at all, somewhat, willing to eat outside only, very confident. Next question, we didn't talk about this specifically, but I know I'm interested in the answer to this question about nail salons and hair salons. How ready are you to go back to your nail salon? From not at all to very. Gyms, we didn't get into too much, but I think that is another area that is both important but problematic because of the amount of metal surfaces and multiple touches and pinch points. But commercial gyms, I think we're in better shape for. Beaches, we've talked about that and the level of opening, whether or not we open at all or to what degree. And then top concerns. So I think I don't know if you can select multiple choices from that or whether you can just pick one, but you can pick your top 2 or 3 if you're allowed to. And last one, okay. All right, so I've only seen 9 responses so far. We'll give it another minute or 2. Up to 11. And Steve, I don't know to what degree, and Chris, you know, this data is valuable for the city, but I think hearing from the residents in this kind of way, some sort of mechanism that polls and conducts surveys is going to be useful for going forward. Not that these are the magic questions to ask, but it is some basis.
No, I agree, and Keith has it, so he could certainly share it with us. And yeah, the more feedback and input we have, the better it always is. Thank you.
So far, nearly 50% would be willing to eat outside at a restaurant. Not at all confident, 25%, very confident, 20, somewhat confident, 10. Women going back to nail salons and hair salons, 55% are somewhat confident.
What do you mean women?
I know, sorry. For gyms, it's split 50-50 between not at all and somewhat. Beaches, this is the one that I would have expected everyone to say open and let us sit. But it actually, 55% so far are saying open only for walking, jogging, and swimming. Top concerns, 62% are concerned about a potential resurgence, 52% available testing, 71% are concerned about the top 2, people not behaving responsibly and enough enforcement resource. And economic impact, I saw a chart the school district put together. They're looking at their budget implications for this year. And this is pulled from their chart. We're looking at it at minimum of 2 times the impact on our economy compared to the 2008 recession, and would exceed anything we've seen since World War II. So I think understanding that better and looking underneath the covers at the numbers a bit would be helpful, the impact data. Okay, so we've got 65% of our group that's voted. Keith, should I just end the poll now? Anybody else that wants to vote, you have 10, 15 seconds. That's a yes to end it, right? Okay. All right. So, and then I share results. Okay. So can you all see the results? All right. So Keith, I have no idea how to save this. This is something that will be saved automatically. I didn't get through that question with you beforehand. I can't unmute. Okay, hold on. Trying to find you, Keith. Sorry for taking up folks' time. Okay. I've unmuted everybody, Keith, to let you speak.
Okay.
You don't have a choice.
Yeah, the results will be saved.
Yeah.
You can save it? Okay. Okay, great. I'm going to go back to meeting
I'm so
everybody.
glad you called. Thanks for calling. Thanks for telling me. Yeah. All right.
Okay. All right. So we're done with the poll. Thank you very much. Very valuable information. We are now going to go back to regular agenda business. And I think our first order of business is the treasurer's report. Keith, would you mind taking back control and sharing the treasurer's report? And I will just, as a reminder to Keith's point, I'm sorry, to Chris's point, census is really, really important. Christina has a beautiful set of resources. We will share that out with everyone. If you could remind your neighborhoods to take that census if they haven't already. And also, it is time to renew council membership. So please, please do renew your council membership. We have gone into the 20th century now, or 21st, with PayPal on our website. So please follow up with that. And with that, Keith, are you saying Keith, are you saying that I need to share my screen for this? Okay. Well, while we're doing that, Melinda, I'm going to unmute you and just have you go over the treasurer's report, okay? I think that's the first item on the agenda. Just trying to find you. There you are. All right, Melinda, over to you.
Okay, thank you for that, Colleen. So just briefly, I don't know if it'll come up on the screen, but I'll just go over it quickly. As of today on May 12, our SunTrust primary business checking account is at $11,183.42. Our PayPal account was at $193 for a total for the council and all accounts of $11,376.42. That is, I did get one payment on PayPal as this call started. Thank you for that. So you can add another $48.25 to that balance. And there we go. So essentially, the last time I spoke to the membership was actually in person. It was on March 10, 2020. We didn't do a treasurer's update in April. And on that date, we had a balance of $10,871.33. What has happened since then? Obviously, I think there's been a little bit less activity than we would normally have during this renewal period. And as Colleen stated, we are absolutely available to take your payment still. whether it be via PayPal or whether you do want to still write a check. I am checking the PO Box weekly. In the intervening 2 months, essentially, we have received 14 payments from 14 different neighborhoods. So thank you for those. And we have had expenses, checks of about $148.16, mostly for reimbursing neighborhoods that brought in food for meetings and some other administrative expenses. So having said that, I will take any questions or comments, but that is the treasurer's report.
And before I move on, I think we do need to do a roll call of board members. Let me unmute everyone, and then Christina, do you want to call the roll? And let me unmute all. Christina, do you mind taking care of that?
No, I don't mind. So I'm going to say everybody's name. If you could just say present after I say your name, I'd appreciate it. So Colleen, present.
Yes.
Okay. First Vice President's vacant. Luis Castillo, are you with us?
Yes.
Okay, myself, I'm here. Mary Peliquin.
Present.
Melinda, we just heard from you. Marilyn Mamano, are you with us tonight?
Present.
Okay, Dennis Ulmer.
Present.
Jim Concanon.
Present.
Michael Albetta.
I am present.
Kathy Stubbs.
I'm here.
And Kelly Manning.
Present.
Okay, thank you. Thanks, Colleen.
Thank you. Okay, so we have a quorum.
Yes.
And I am going to
Unmute.
Colleen, I have a question regarding the treasurer's report.
Sure.
Have we sent out an email to the members reminding them that the dues are due?
We will do that, and we'll discuss it at our board meeting to send that out. I think we've all been burrowed in with other needs at the moment, but yes, good point, and that will be sent out. We'll discuss that at our board meeting to talk about.
Okay, thanks.
Okay, so acceptance of the treasurer report. Next item of business is election of first VP. We announced the vacancy 2 months ago. We have one candidate that is, I don't want to say willing, that we'd love to have take on the role of first VP. She is already acting in an officer capacity. Mary Peliquin is the only individual I know about that is running for first VP. So unless there are any other folks that are interested in announcing themselves as a candidate, I will give a moment for anyone to share whether or not they're interested in acting. If you're already a member, if you would like to run for first VP, speak now, or we will vote on Mary.
Colleen, did you confirm the quorum of all of the general membership, or were you just referencing quorum for board of directors? Because we need a general membership quorum at this point in time.
Thank you. Good point. Mary, do we have quorum?
Yes, we do have a quorum of general membership.
How convenient.
Okay. So if anyone is interested in being first VP, you've got a chat box or you can speak, and please go silent, please. With that, I'd like to nominate and call for a vote on Mary Peliquin to act as first VP. And I think probably the way to do this is just to call for all in favor, say aye.
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 Any opposed? I was going to mute you if you did. So, all right. Congratulations. Thank you very much, Mary. Very happy, very thrilled that you are our first VP. Thank you for taking that slot. Really appreciate it. I could ask you to make a few comments, Mary, but I'm not going to put you on the spot.
Okay.
Colleen, of course, now we have a vacancy for recording secretary.
No, we don't. She's playing dual role. She's playing dual role.
God bless you, Mary.
Yeah. All right. So the only item to vote on tonight is review and acceptance of our general meeting minutes from last month. we have met quorum. Can I hear a motion?
I move to accept the minutes. Luis Castillo.
I second Marilyn Milano.
Thank you. All in favor?
Aye.
Okay. Minutes are approved. Last item of business is just our upcoming meeting dates. We meet as a board on May 26th, and our next general meeting is June 9th. In addition to Vice Mayor Glassman, which we're thrilled to have at our June meeting, we're also entering hurricane season. So Chief Rna Virus has agreed to meet with us next month. We thought it would be too much this month to talk hurricane as well. But as we are up against it, with hurricane and reopening and the pandemic, it's very timely. So those are our two confirmed speakers for next month. With that, unless there are any final comments or inputs, I am going to call for the meeting to adjourn. I'll let anyone share or make any comments before I do so.
Thank you all. It's been a pleasure listening. I appreciate it. Thank you.
Thank you.
I have a question.
Yes.
Our next board meeting, do we expect it to be a Zoom meeting?
100%.
Thank you.
Okay. And yes, who was that?
Terry.
Yes, Terry.
I tried to raise it through Chris when he was online. Is parking enforcement going on? Do we have to pay for parking when we try to go out in this new phase?
That was a discussion at the commission workshop. I don't think there was a final decision made. I think the general consensus or feeling from the commissioners was that that was a good idea. I don't think there was a final call on it, but we will raise it as something we will ask the commission about and get that formal communication just as a question to Chris, if nothing else, as a starting point. I don't think they have a final call on it. But I do think that there's a general sense that that's going to be very helpful, and anything that will encourage folks to be out and about is going to be something they're going to want to support. So,
will that be just in the restaurant areas, or will that be all around the city?
The answer is we don't know yet. We don't know yet. We'll ask. And the request is that it be all over. Is what you're suggesting, and I hear you.
Correct. And I have one other question.
Yep.
The symptoms for the corona seem to be mimicking the same thing as people with hay fever and sinus things. Are they going to be monitoring guests as they come into hotels? If they start sneezing, coughing. What happens when someone might be sitting next to me that starts coughing? What can we do? What should we do?
I'm not prepared to address these kinds of questions at this point, at this time, Terry. I think one of the purposes of having Michael and Tim talk was to explain some of the precautionary measures that they were planning and would have in place. I think that there's going to be very clear guidance and insistence on not only the safety measures to screen the employees, but also patrons, right? So it's a valid question. If you're a paying hotel guest and you walk into the hotel lobby to check in and you are coughing or sneezing, what happens? That is an excellent question, and I don't know the answer, but I can't imagine and wouldn't be anything other than, I'm sorry, we can't honor your reservation. But I don't want to speak for hotels or restaurants for that matter. But yes, I mean, the idea is if you're exhibiting symptoms, you're not going to be congregating or out in public. And that's in part what we talked about in terms of the general public acting responsibly. If you've got those symptoms, you shouldn't be checking into a hotel unless you can prove the doctor said it's hay fever, right? It's not, it's not COVID. So long-winded way of saying, I'm not clear, I'm not sure. I think there's a great deal of uncertainty. Our job is to behave responsibly, employ common sense actions, and if you are around someone that is acting irresponsibly or exhibiting symptoms, get the heck out of Dodge. That's what I would do.
Colleen, I think Christina Curry has a question, but I'm not able to unmute.
I'm unmuted now, but I couldn't unmute before, and the chat wasn't getting to you. I just wanted to let everybody know that our past census speaker provided us a link to Google Drive, and I've posted that on our homepage, and you can go there and you can pull their social media materials, their public service announcements, everything that the Census Bureau is providing, and they want us as neighborhood leaders to be sharing that with our residents. Again, you can find it on 2 places, on the Council of Civic Associations homepage, and you can also find it under information for members there. Thank you.
Thank you, Christina. Thanks very much. So with that, I just want to thank all of you, thank our wonderful speakers. Been hopefully very productive and informative for everyone. I know it was for me. Thank you all, and we look forward to seeing you next month.
Bye-bye. Thank you.
Bye.
Thank you.
See you May 26th.
Okay. All right. Now I'm trying to end the meeting. Trying to figure that out. Okay. End meeting. There we go. Bye.